Which is more important, embryo or endometrium? I am Dr. Neeraja Fertility Specialist from Hyderabad. So endometrium and embryo are both are equally important. So both have equal weightage. So before IVF, we need to assess the endometrium. If there is any doubt in the endometrium, we need to advise some test for the endometrium like endometrial biopsy or diagnostic hysteroscopy, or for some patients if first IVF fails, then we'll go for ERA test, endometrium receptive assay test. So the normal endometrium thickness minimum should be 7 mm for IVF patients before embryo transfer. If it is less than 7 mm, even for some patients, even if it is less than 7 mm, we are seeing pregnancies, but in general, good endometrial thickness is around 7 mm. So the maximum limit is around 10 to 11 mm. If it is more than 12 to 13 mm, it's not advisable. So endometrium evaluation before IVF is mandatory for each and every IVF patient. And if you come to embryo, so embryo assessment, embryo quality, they are very important for to get pregnancy. So if any doubt about embryo quality or any couple with any genetic problems, then we need to test the embryo. That is called pre-genetic testing. Here we'll send biopsy of the embryo. So where we can see whether the embryo is euploid or aneuploid. Euploid means good embryo, aneuploid is bad embryo. So general euploid embryos will be transferred to get maximum success in IVF. So we can't say which is more important. So both endometrium and embryo both are equally important, and endometrium assessment before IVF is mandatory, and embryo assessment, so it's a process. So we'll prepare the embryo, we'll grade the embryo. So embryo testing is not done for all patients. There are specific guidelines, there are specific criteria to do embryo testing. For those patients with repeated abortions, any genetic anomalies, repeated implantation failures, for these kind of patients, we'll advise embryo biopsy. Thank you.